Sarans Daisy Hospitals.
PCOS, it's very common phenomenon. The thing we have to consider is the hormonal disorder that occurs to the woman in the reproductive age. Between 20 to 28 age group are facing this. The major reason that is leading to PCOD is the change in the dietic pattern that we are noticing. Now everyone is moving towards the fast food era. No one is willing to do any physical exercises, so these are leading to PCOD problems. When we are discussing about the complications that PCOD leads to, infertility, it can also lead to some heart problems. For a doctor to rule out it's a PCOD, there are three factors. One is Hello everyone, I am Dr. Revathi Ravikumar, consultant homeopath, Sarans Daisy Hospital. Today we are going to discuss about PCOS. It's Polycystic Ovarian Syndrome. So PCOS, it's very common phenomenon in the modern world. And when we are dealing about PCOS, the thing we have to consider is the hormonal disorder that occurs to the woman in the reproductive age. When we are comparing the ratios, around 16% of the population in the reproductive age between 20 to 28 age group are facing this. When we are dealing about the causes which is causing PCOD, they are the increased level of androgen, that is the male hormones, that is resulting in the PCOD. And the major reason that is leading to PCOD is the change in the dietic pattern that we are noticing. Now everyone is moving towards the fast food era. So, and the lack of exercises too. No one is willing to do any physical exercises, so these are leading to PCOD problems. So when we are moving towards the symptoms that is causing PCOD, they are menstrual irregularities. Sometimes menses would be very heavy and sometimes it would be very much scanty. Sometimes there would be increased hair growth in facial, there would be appearance of hair growth, and all throughout the body there would be an increased hair growth pattern that we will be noticing, that is known as hirsutism. And the other factors or the other symptoms that we would be noticing would be the changes in the behavior. The person would be very much stressful during the time of menses. There would be heavy pain during menses. These are all the major symptoms that we would notice when we are dealing about the PCOD. For a doctor to rule out it's a PCOD, there are three factors. One is increased androgen level. The second one is the presence of cyst in the ovary that would be found out in USG. And third one is the irregularities in the periods. So if 2 out of 3 is positive, we will decide that the person is suffering from PCOD. Examination techniques are definitely the clinical examination. Second one is the USG, that was a routine test that we undergo. When we are discussing about the complications that PCOD leads to, they are infertility. If not dealt very seriously, the PCOD can lead to infertility. It can also lead to some heart problems. Sometimes insulin resistance occurs, so the insulin would be produced in our body but it would not be used very effectively, so it would lead to type 2 diabetes mellitus. Third one, there would be some cholesterol issues, then there would be changes in the weight pattern. All these are the complication that we will notice when PCOS is not carefully dealt. So my humble request to the viewers that is who is seeing this video is, whenever you are noticing any changes in your body, please do not hesitate to visit a doctor and try to have a consultation, so that sometimes simple techniques or simple medicines that we are having can improve your health and can lead to a healthy lifestyle. When we are dealing with how to prevent the disease, to the young girls, how to prevent PCOD, the first thing you have to do is do regular exercise. It's for about 20 minutes to a half an hour a day. You should go for regular exercises. If you can't do exercise, just go for walking. That could also help you out. Second one, do have a careful look towards your diet. You have to include healthy diet in your food. Actually, it should have a great quantity of iron. Always there is a iron loss when your menses is going on. There is always a need for plenty of iron in your food. So do take green leafy vegetables. Do take some dry fruits and nuts that is available. So these are the things that has to be taken care of to prevent PCOD. And those who had PCOD, they should always take care that do consult a doctor, get the medical advice, do concentrate on your physical activity, and take the medication as directed. And when we are talking about the alternative system of medicine, Siddha, Ayurveda and homeopathy, these are offering great miraculous remedy for this PCOS. It will not create any side effects in your body, but it's definitely will help you out to get rid from this complaint. So let's have a healthy life ahead. And if you have any doubts regarding this topic, that is PCOS, or if you are facing any types of irregularities in the menses, please do not hesitate. Do comment below so that we can get back to you. We will have a discussion on that, and there would be videos posted ahead after this in all your doubts. Thank you.
Sarans Daisy மருத்துவமனையின் உலகத்தரமான சிகிச்சைகள். இங்கு சர்க்கரை வியாதி, தைராய்டு, இடுப்பு வலி, L4, L5 கம்ப்ரெஷன், மூட்டு வலி, முதுகு வலி, கழுத்து வலி, இரத்த சோகை, இரத்த கொதிப்பு, ஆஸ்துமா, சைனஸ், அல்சர், மூக்கில் சதை வளர்தல், டான்சில்ஸ், உடல் பருமன், சிறுநீரக கல், பித்தப்பை கல், கல்லீரல் பாதிப்பு, மூலம், பௌத்திரம், மலச்சிக்கல், முடி உதிர்தல், இளநரை, சொரியாசிஸ், அனைத்து தோல் நோய் பிரச்சனைகள், வெள்ளைப்படுதல், வெண்படை நோய், வெரிகோஸ் வெயின், ஒற்றை தலைவலி, கொழுப்பு கட்டிகள், நரம்பு தளர்ச்சி, கண் பார்வை குறைபாடு, தூக்கமின்மை, மாதவிடாய் கோளாறுகள், கர்ப்பப்பை கட்டிகள், விதைப்பை வீக்கம், குழந்தையின்மை, பக்கவாதம், முடக்குவாதம், இருதய பாதிப்புகள் போன்ற தீராத அனைத்து வியாதிகளுக்கும் அறுவை சிகிச்சை இல்லாமல் அனுபவம் வாய்ந்த அரசு பதிவு பெற்ற மருத்துவர்களால் உயர்தரமான சிகிச்சைகள் வழங்கப்படும். Sarans Daisy Hospitals.